The state's largest employer has a new CEO, and in just a few short months on the job, she's already faced down major issues, from repeated attempts in Washington to change the healthcare system to an active shooter situation. Dr. Joanne Conroy, the CEO and president of Dartmouth-Hitchcock, joins us here today. Doctor, thanks for being here.
Thank you for inviting me.
We appreciate it. The specter of gun violence is obviously something that is casting a large shadow over the United States today. The scope of the bloodshed we saw in Las Vegas is staggering, but at the same time, even when it's one victim in a hospital, that's a visceral reaction too, because that's where people go to get well. How is your community and the ICU recovering from what happened in September?
So the first thing we've done is really let people talk about how they feel about the situation. People are going to recover from a different place, every single individual. We found that some people that were closer to the event, it's going to take a little bit longer, but we also found a lot of our employees that had experience with other events. We had some people that were at Sandy Hook, and it brought back some of those memories. So everybody's going to recover at a different pace. But we've looked at how secure the organization is, and we've talked about how we can beef up security. We've talked about locking down doors so nurses will be able to press a button and secure their area. Those are any number of the conversations we're having. We want to make sure that people feel safe, but also they feel empowered, because the most effective way to identify and actually intervene is to actually have the staff say something's not right with this individual, this family member, this visitor.
And Dartmouth-Hitchcock up in Lebanon is a level 1 trauma center. We saw that was such a crucial role in Las Vegas in terms of absorbing the number of people that were wounded. I mean, this is, again, more than 500 people wounded in a situation like that. How would what Dartmouth-Hitchcock does respond to a situation like that? Maybe not in the Upper Valley, but certainly would be getting patients if something happened regionally like that.
Yeah. What's amazing about healthcare providers is their responsiveness to a mass casualty event like that. So we would inform all of our providers across the entire community if we had massive numbers of people that were being airlifted or through ground transport to our emergency room, and people come in whether or not they are supposed to work that day. And also our employees line out to get blood. So it becomes really a community effort to address the healthcare needs of those victims.
And from a capacity standpoint, I mean, 500 people, how would that be absorbed, say, at your campus in Lebanon?
You have to use a network of hospitals to care for people. You have to triage them on the scene. There are many people that can be cared for at the scene, and there are those that have to be transported to an acute care facility. But we would definitely lean on our partners across Maine, New Hampshire, Vermont, and Massachusetts to get people to the care as quickly as possible.
Let's turn to Washington. Repeated attempts to reform or change the healthcare system that we have currently. I'm fair to say, I guess, not many people are satisfied exactly 100% with the system we have now. What are some changes that you would propose or would like to see right away that could improve things from a hospital standpoint?
I would like the government to continue to pursue innovative payment models, because rationalizing care or limiting care, removing access to health care is not the solution. Those people are going to come right back to us in our emergency room with healthcare conditions that have just escalated because they haven't been able to access care. So I'm in favor of really innovative payment methodologies that allow us to use the same number of dollars but maybe deliver care in a lower cost setting. Our facilities here in Manchester are office-based facilities. The care that you receive in Manchester Dartmouth-Hitchcock facility is going to be less expensive than the care you receive in a hospital. So how can we actually deliver care in a lower cost setting? And even lower would be, how do we deliver care in the community, in a patient's home, that actually keeps them healthy? We have participated with TDI, which is the Dartmouth Institute, in identifying ways to actually deliver care out of a traditional healthcare setting, and a lot of them have been incredibly successful. We've had things on senior care, behavioral health, that have demonstrated that it actually saves money and makes people healthier.
Do you have confidence that they can take those steps in Washington right now? Even the simple things they wanted to do, they could not get done.
Think back when the Affordable Care Act rolled out. We weren't doing anything around innovation, around accountable care organizations, around bundle payments. In the short period of time that we actually launched those, we learned a lot about how we could save money. I think we just need to keep doing that. So I would love for the government to continue to fund those innovative projects, because we all learn. Healthcare providers now understand that language of what the cost of care is, what the quality is, and how we can actually improve both.
And here in New Hampshire, we're obviously in the grips of an opioid crisis. For most people, they visualize this as an urban problem, but it is everywhere. Explain for us what you see on a daily basis in Lebanon and the Upper Valley there in terms of the opioid crisis.
So first of all, when I was working in an emergency room in Charleston, South Carolina as an intern, we had an opioid crisis there. People would come and they looked like they were a professional, and they would have a needle that's broken off between their toe or their finger. So then it was heroin. Since then, we have a number of synthetic narcotics that are dangerous because they're potent and they cause euphoria. And that just leads to further abuse of the drug. We also are facing this kind of tsunami wave of drugs that are being shipped in from other countries. So we have this overwhelming access and supply. It doesn't occur just in an urban setting. Rural areas are very, very susceptible to this because many of them have lower economic opportunities for the people in the community, and sometimes they turn to substance abuse. So it's an issue that we've got to deal with it on a community by community basis. There won't be one size that fits all. It's one of those social problems that can't be solved by one organization. As a community, we've got to work together to solve it.
And on the flip side, pain management. There are a lot of patients who are not addicted who are finding it difficult right now to deal with pain.
Very difficult. I actually was a pain management specialist in the heyday when we started using more and more narcotics to treat chronic pain. Even then, we said there could be a downside to this years down the road, and I think we're seeing that. That's going to be the challenge, is making sure we treat people with chronic pain appropriately, but make sure that we don't overtreat people and make sure we don't have excess drugs that are accessible to young people in the houses in which these pain patients actually live.
And speaking of young people, you are the first woman CEO in Dartmouth-Hitchcock history, correct?
I am.
What would your message be to young women or girls out there in terms of being able to attain a position like that as they work through their careers?
So just do it. I spent a lot of my career saying yes and taking advantage of every opportunity that was put in front of me. I think I want young women to really be confident about the fact that they can be incredibly successful at any role, and they just have to have really confidence in their own abilities and also continue to reach out for mentors and people that want to advise them. And there's a world of people that are all unified in helping the best talent actually achieve leadership roles.
All right. Well, my daughter is 3 and she wants to be a gastroenterologist already. So
awesome.
I'll send you a resume or something like that. Doctor,
awesome.
Thank you so much for your time.
Thank you very much.
Appreciate it.
Thank you.